Welcome to our deep dive into the world of spinal trauma. You know, it's one of those things you hear about, but maybe you haven't really thought deeply about until today. We're going to be dissecting a chapter from a trauma emergencies textbook. And trust me, it's full of real-life twists and turns that'll leave you with a whole new perspective on spinal injuries.
What's fascinating here is that it's not as straightforward as a broken bone. We're talking potential damage to the spinal cord, which can impact the entire body in ways you might not expect.
Or it's like a domino effect.
Yeah.
Speaking of unexpected, imagine yourself as a first responder arriving at a scene. A motocross accident in a remote national park. You find an 18-year-old named Dan lying face down after a nasty crash.
The hikers who found him said he's conscious and talking. His pulse is strong, but there's a catch. He's incontinent, both urine and feces, and although he says he can't move, he's not in any pain.
Wait, no pain? That seems odd given the situation. Isn't that a red flag?
It absolutely is. It could be a sign of spinal shock where the body's pain signaling is disrupted. Now, you might be thinking, how is that even possible? Well, the spinal cord is like a superhighway for information, and when there's trauma, those signals can get scrambled.
So it's not just the injury itself, but the body's response to it.
Yeah.
And get this, the textbook also mentions Dan having an erection. Now, I know this might sound a little out there, but
It's actually a possible symptom of spinal shock. The disruption of nerve signals can lead to what's called priapism.
wow, okay. That's definitely not something you typically associate with a spinal injury. Let's move on to Dan's vitals. His blood pressure and breathing are stable, and his skin is normal. But his EKG shows sinus tachycardia. What exactly does that mean?
Sinus tachycardia simply means his heart rate is elevated, which is a normal response to trauma. Think of it as his body going into overdrive trying to compensate for the stress.
So his body's kind of freaking out, which makes sense given the circumstances. So what happens next? What are the priorities for Dan's care?
The first priority is always airway management, making sure he can breathe properly. Then they'd immobilize his C-spine, basically stabilizing his neck, and whisk him off to a trauma center.
And why C-spine specifically?
Well, based on the initial assessment, the textbook suspects a possible C6 fracture. Now, you may be wondering, what's so special about C6? To understand that, you need to picture the spinal cord like a roadmap with different exits controlling various parts of the body. C6 happens to be a critical junction for arm and hand movements.
So a fracture there could have serious implications for his ability to use his hands. That's a scary thought.
It really highlights the delicate nature of the spinal cord and the potential for long-term consequences. Now, while we have Dan's case fresh in our minds, let's shift gears a bit and talk about Carly.
Okay, so Carly's story takes place at a party. She fell into a shallow pool, and now she can't move, complaining of severe back pain. Quite a different scene than Dan's motocross crash, right?
Yes, indeed. The mechanisms of injury are vastly different, and this underscores the point that spinal trauma can happen in unexpected ways.
And here's a key difference from Dan. Carly is feeling the pain, right?
Exactly. And that pain tells us the nerves responsible for pain signals are still working, which could suggest a different type of spinal injury than Dan's.
Interesting. So even the presence or absence of pain can provide valuable clues. Her vitals were stable, and her EKG is normal. What happens next in her case?
Given the potential for spinal injury, they'd carefully remove her from the pool, immobilize her spine, and transport her to the hospital for further evaluation. It's always better to err on the side of caution.
Okay, so both Dan and Carly have potential spinal injuries, but their presentations are completely different. What's the takeaway here for someone like me or, anyone listening?
What's fascinating is that these cases illustrate how diverse spinal injuries can be. Dan with no pain but signs of spinal shock, and Carly with localized pain and numbness. It highlights the crucial role of a thorough assessment looking beyond the obvious.
Right. It's like detective work piecing together the clues to figure out what's really going on. So it's not just about asking, do you feel pain? It's about considering everything. How the injury happened, vital signs, checking reflexes and sensation, getting the patient's history.
Absolutely. It's a holistic approach. Every detail adds to the bigger picture, and that's what guides treatment decisions and ultimately influences recovery.
Okay, so we've established that early intervention is key. But before we move on to treatment, I'm curious about something. You mentioned earlier that spinal cord injuries can have effects beyond what we typically think of. Can you elaborate on that?
Of course. Aside from the obvious physical impact, we need to consider the potential for spinal shock and neurogenic shock, both of which can disrupt the body's internal balance in profound ways.
Let's unpack those, starting with spinal shock. What exactly is going on there?
Think of spinal shock as the body hitting the pause button on the nervous system below the injury. It's a temporary loss of reflexes, sensation, and even movement.
So it's like the spinal cord is in shock, literally. And how long does this pause last?
That's the tricky part. It varies. It could be hours, days, even weeks. And here's something you might find surprising. Spinal shock doesn't always mean permanent damage. It's the body's way of protecting itself while it figures out what's going on.
Okay, so it's not necessarily a worst-case scenario. But what about neurogenic shock? That sounds a lot more intense.
Neurogenic shock is a whole different ballgame. It's not the spinal cord itself in shock, but rather the disruption of the autonomic nervous system, the control center for things like heart rate, blood pressure, and even temperature. Imagine the thermostat in your house going haywire because the wiring got messed up.
Okay, so it's a system-wide malfunction. And how does that play out in someone like Dan or Carly?
Well, imagine Dan with his suspected C6 injury. Remember how C6 is high up in the neck. Injuries above the T6 vertebra, about midway down your back, are particularly prone to causing neurogenic shock. This is because the nerves controlling those essential functions branch out from the spinal cord in that area.
So a higher injury means a greater risk of this system-wide chaos.
Exactly. And that's why recognizing the signs early on is crucial. Instead of the typical fight or flight response where your heart races and your blood pressure goes up, neurogenic shock presents a bit differently.
How so? What should we be looking for?
Think opposite. A slow heart rate, called bradycardia, a drop in blood pressure, hypotension, and even warm, flushed skin because the blood vessels aren't constricting like they normally would.
So it's not always the dramatic Hollywood-style presentation we might expect. It's almost like the body is shutting down.
In a way, yes. It's a loss of that sympathetic nervous system drive. And that's why prompt medical attention is critical. Treatment might involve fluids to boost blood pressure, medications to stabilize heart rate, and constant monitoring.
Wow, this is getting really intricate. So we've talked about the initial assessment, the potential for complications like spinal and neurogenic shock. But what happens next? Let's walk through the steps of managing a spinal cord injury.
Well, let's go back to the scene of the accident for a moment. You're the first responder. You see Dan lying there. What's your absolute top priority?
From what we've discussed, I'd say immobilization is key, right? Don't move him unless absolutely necessary.
Spot on. The golden rule is do no harm. Any unnecessary movement could worsen the injury. So you'd stabilize his neck with a cervical collar, get him on a backboard to support the entire spine, and make sure his head and neck are in a neutral position. No dramatic tilting back of the head like you see in the movies.
Okay, got it. Safety first. But what about his airway? We need to make sure he's breathing.
Absolutely. Airway management is vital, but it has to be done with extreme caution. There are specific techniques like the jaw thrust maneuver that allow you to open the airway without moving the neck.
I'm starting to see just how specialized this field is. Every move has to be calculated.
Exactly. And it's not just about what you do, but how you communicate. The paramedics on scene need to relay every detail: how the accident happened, Dan's condition, what they've done so far to the hospital team. It's a relay race against time.
So that the trauma team is prepped and ready to go when he arrives.
Precisely. And once at the hospital, things shift to a more in-depth assessment and stabilization phase.
What does that involve?
A comprehensive neurological exam is a must. It's like taking inventory of the nervous system, checking Dan's strength, sensation, reflexes, all the things controlled by the spinal cord. They'll also do imaging studies, probably a CT scan or MRI, to actually see the damage to the spine.
It's like putting together a puzzle, isn't it? Using all the pieces of information to understand the extent of the injury.
That's a great analogy. And based on that picture, the treatment plan is formed. It could range from conservative management with bracing and immobilization to surgery if things are more severe.
Let's talk about surgery for a moment. When would that be necessary in a spinal cord injury?
Surgery is usually reserved for cases where there's significant instability in the spine, compression of the spinal cord itself, or when those initial conservative approaches haven't worked. The goal is to stabilize the spine, prevent further damage, and hopefully improve neurological function.
So it's not a first resort, but a crucial option when needed. And what about recovery after surgery? What can patients expect?
Well, it's a long road, and I won't sugarcoat it. It can be tough. Rehabilitation is key. Physical therapy to regain strength and movement, occupational therapy to relearn daily tasks, maybe even speech therapy if communication has been affected.
It sounds like a multidisciplinary approach with different specialists working together.
Exactly. It's all about tailoring the program to the individual's needs and goals. And remember, it's a marathon, not a sprint. Patience and perseverance are key.
And support systems play a huge role, right? Family, friends, therapists.
Absolutely. That support network is vital for emotional well-being, for practical help, and for navigating the challenges that inevitably arise. It's a team effort.
Okay, so we've covered the basics of management, but I want to bring it back to Dan and Carly. How might all of this apply to their specific situations?
Let's start with Dan. Given his potential C6 fracture and signs of spinal shock, immediate immobilization, careful airway management, and close monitoring of his vitals would have been crucial during transport. At the hospital, imaging studies would have confirmed the diagnosis and shown the severity of the injury.
And because his potential injury is so high up, would surgery be more likely?
It's definitely possible. If the fracture is unstable or pressing on his spinal cord, surgery could be necessary to stabilize things and prevent further damage.
And what about his recovery? What might that look like?
Well, a C6 injury means his rehabilitation would focus on regaining as much function in his arms and hands as possible. He might need adaptive equipment to help him with daily tasks.
It sounds like he's got a tough road ahead. What about Carly? How would her management differ considering her potential L2 injury and those heel fractures?
First things first, those calcaneus fractures, the broken heel bones, would need to be addressed. Depending on the severity, surgery might be needed to repair them.
Ouch, that sounds painful.
It definitely can be. And those fractures would add another layer of complexity to her recovery. As for the potential L2 spinal cord injury, imaging studies would have been done to confirm the diagnosis and check for any damage.
Would surgery be on the table for her as well?
It's less likely with an L2 injury, especially if there's no pressure on the spinal cord, but if it's unstable, surgery might be needed to stabilize her spine.
And what about her rehabilitation? What would be the focus there?
Regaining strength and mobility in her legs would be a top priority. She might need to learn how to walk again, potentially with some help from assistive devices.
So both Dan and Carly would have long roads to recovery, but with different challenges. It's clear that spinal cord injuries, regardless of location, require a tailored approach.
Absolutely. It's not a one-size-fits-all situation.
Hmm.
And while we've focused heavily on the physical aspects, we can't overlook the emotional and social impact of these injuries.
You're right. Recovering from a spinal cord injury goes beyond regaining physical function. It's about adapting to a new way of life, and that can be incredibly challenging.
Imagine the emotional roller coaster. The shock of the injury, the fear of the unknown, the realization that life might be permanently different. It's a lot to process.
And then there are the practical hurdles, navigating a world that isn't always accessible, dealing with limitations, and potentially relying on others for help with things you used to take for granted.
Exactly. It's a huge adjustment, and it's easy to feel overwhelmed, frustrated, even isolated.
So what can be done to help people navigate those emotional and social challenges?
Yeah, that's where support systems become absolutely vital. Family, friends, support groups, therapists, they all play a crucial role.
How so? Can you give some specific examples?
Welcome back to our deep dive into spinal trauma. We've explored the medical side of things, the initial response, the complexities of treatment, and the long road to recovery. But now let's shift our focus to something equally important: the human side of spinal cord injuries. Yeah, it's crucial to remember that behind the medical terms and diagnoses are real people navigating life-altering experiences. They're facing challenges that many of us can't even imagine.
It's easy to get caught up in the technical aspects, but we can't forget the emotional and social ripple effects of these injuries.
Imagine the emotional turmoil someone goes through after a spinal cord injury. The initial shock, the fear of the unknown, the realization that life may never be the same. It's a profound and often overwhelming experience.
And those feelings are compounded by the practical challenges of navigating a world that isn't always designed for accessibility.
Think about it. Simple tasks like getting around, using the restroom, cooking a meal can become daunting obstacles. And that can lead to frustration, helplessness, and even social isolation.
It's a stark reminder that recovery isn't just about physical healing. It's about adapting to a new way of life, both emotionally and practically.
And that's where support systems come in. Family, friends, support groups, therapists, they all play a vital role in helping individuals navigate this uncharted territory.
It's about creating a safety net, a network of support that empowers individuals to rebuild their lives and find meaning and purpose in the face of adversity.
Loved ones provide emotional support, practical assistance, a shoulder to cry on. Support groups offer a sense of community, a space to connect with others who truly understand. And therapists provide coping mechanisms and tools for processing the emotional roller coaster that often comes with a spinal cord injury.
It's about fostering a sense of hope, helping individuals see that while life may be different, their dreams and aspirations are still within reach.
Exactly. We often see individuals with spinal cord injuries achieving amazing things, becoming advocates, athletes, artists, entrepreneurs. They challenge perceptions and redefine what's possible.
It's a testament to the resilience of the human spirit to overcome adversity and find strength in unexpected places.
It's a reminder that while spinal cord injuries present unique challenges, they don't have to define a person's life.
So as we wrap up this deep dive into spinal trauma, what key takeaways do you want to leave our listeners with today?
Remember, spinal cord injuries are complex with far-reaching consequences that extend beyond the physical. Early intervention is key, and that means proper immobilization and prompt medical attention.
We also can't forget the importance of rehabilitation, addressing not only physical function, but emotional and psychological well-being as well.
And above all, remember the importance of hope, resilience, and the incredible capacity of the human spirit to adapt and thrive in the face of adversity.
Well said. We've explored the science, the challenges, and the triumphs. As we conclude this episode, I encourage you to reflect on the questions we've raised. How can we as individuals and as a society create a more inclusive and supportive world for those affected by spinal cord injuries?
Let this be a starting point for ongoing dialogue and action. Let's advocate for accessibility, support research efforts, and foster a culture of empathy and understanding that values and embraces diversity in all its forms.
On that note, we'll leave you to contemplate these important questions and encourage you to continue exploring this fascinating and impactful field. Thanks for joining us on this deep dive.